Hi, I'm Adam Rosen. I'm a board-certified orthopedic surgeon who specializes in total knee replacements. So in today's episode, I want to talk to you about what it's like at 1 month after your knee replacement. If you're going through the first couple weeks, you're trying to figure out, is what you're going through normal, or should you be concerned? And if you're thinking about knee replacement, it's very nice to know what you should expect, like what's actually coming after the surgery. So when I see patients back at 1 month, I do let all of them know that it's still normal to have pain. You're going to have some pain, but the pain should be diminishing. It should be getting better. And even right away, a lot of patients notice the pain they have is different than the pain that they had prior to surgery. But having some pain is still normal. You should not be requiring any narcotics. Most commonly, people at the 1 month mark may be taking acetaminophen, which is Tylenol, or some form of an Nsaid, an anti-inflammatory, something like Celebrex or meloxicam, which would be prescribed to you, or something over the counter, like ibuprofen, which is Advil or Motrin, or naproxen, which is Aleve. And some people will do a combination of those two. They'll take an acetaminophen pill and some form of an anti-inflammatory. But what medicines you should use and what doses you should talk to your doctor. It's also very common to still have night pain. This is something that I talk to my patients about prior to surgery just to let them know, but I reinforce it at 1 month that if you're having difficulty sleeping, that is still quite normal. We're not really sure as to why people have this pain. Most commonly, it's due to stiffness that causes an achiness and a pain that then wakes you up. And I find that many patients, as they get better range of motion, that night pain goes away. So it's sort of an incentive for you to work harder in the beginning to get more range of motion early. The other common things that a lot of people see is that the knee will feel warm. That can be common for months and sometimes up to 2 years. There's increased blood flow to the area. So just because your knee feels warm doesn't mean that there's a problem or there's an infection. It will also, again, feel numb. You've heard me talk about this before, about common expectations. But the skin, especially on the outside of your scar area, that skin will feel numb. And sometimes that numbness may persist for a year or more. It will click. You'll be very aware of your knee. Everything that your knee does, you're super aware of. And especially if it's a little swollen inside, when the plastic and the metal separate and then touch, you'll hear or feel a click. That does not indicate that something is loose or broken. It's just you hear or feel that metal touch the plastic. Your knee will also have a round appearance. Even people that don't have any more swelling or fluid in the knee, it'll give this sort of round appearance to your knee. So that's common. At this point, at the 1 month mark, your wound will be healing, but it will not be super mature. So at this point, if you had staples, they should be out. I use a glue with a little mesh called Proneo with Dermabond. Your doctor may use absorbable stitches of some sort. But in any event, your wound should be maturing. And what we'll typically use is some type of over-the-counter moisturizer as a lotion. Very commonly, people will use a vitamin E capsule, pop it and spread it out and massage it on the scar. That helps flatten the scar. It gives a better cosmetic appearance, but more importantly, it desensitizes the scar. So it makes the scar less sensitive to pain and to touch. And you can also do what's called scar mobilization. Your therapist will show you how to do this by moving the scar back and forth and up and down and playing with it. It breaks up any adhesions that can form between the skin layer and the layer below it. A cane you should be off of. Now, this is very individual. So if I met a patient in a wheelchair or who was using a walker for a year, they may still need some type of assisted device. But for the majority of patients that I see back at 1 month, they'll come in with a cane. I'll ask them if they're using a cane on a regular basis, and they'll usually tell me, no, I'm not using it, but I brought it today because I was not sure where I was going to park and how far I was going to have to walk in to get into the office. Now, physical therapy for many people will be over or ending. You'll transition to a program on your own. Range of motion, your knee should be almost totally straight, what we call 0 degrees, and you should have around 110 degrees of motion. That means that you're moving in the right direction. I always recommend to my patients, aim for 90 degrees the day after surgery, 100 at 2 weeks, 110 at 4 weeks, 120 at 6 weeks. So if you're at 110, you're doing great. If you're at 120, you're a superstar. If you're at 100 or below, you're a little behind. So we got to play catch up. And that again depends on where you started. If you had less than 90 degrees before surgery and you have 105, that's great. You've made a huge improvement. But we want to aim for those goals because the first 6 weeks up to 12 weeks, but mainly the first 6 weeks are your best chance to get range of motion. So if somebody's struggling, usually what I would see is what's called an extensor lag, meaning I ask you to straighten your knee. You can almost straighten it all the way, but if I hold your heel and you relax it, the leg straightens. That means that your knee can straighten, but you lack the strength in your muscle, your quad muscle. So I have a whole other video on this, what we call terminal extension. And it's an exercise that you can use to focus on getting those last couple degrees of straightening with strength. The other thing that you'll see is if you're lacking in being fully straight, what we call extension, or bending. There's 2 chair exercises I use. I have another video that you can watch also that I show patients after surgery. I have them typically do it breakfast, lunch, and dinner. But if you're a patient who's struggling with the straightening or extension, I'll have that patient do that straightening exercise every hour on the hour for the next 2 weeks. And vice versa, if they have difficulty with the bending, but the straightening's great, I'll have them do the bending exercise every hour on the hour for 2 weeks or until they get better range of motion. Now, ice can still be your friend. So after exercise and therapy, it might be sore, stiff, swollen, you can ice it. The other little trick that I have patients use around 1 month is heating before. So if the knee's stiff and achy, think of this as pudding that's been sitting in the refrigerator gelling up. You haven't moved the knee. It's like putting the pudding back on the stove. It liquefies. So by putting a heating pad on your knee for, say, 5 minutes before surgery, it loosens up the tissue and sort of liquefies any blood or scar tissue that can be in your knee, and that can help with range of motion. Now, the last thing is patients always have a question, can I get back in the pool if I have access to a pool? Or can I get in my hot tub? I have a hot tub or jacuzzi. Usually for the majority of patients, the safe time is 6 weeks from the day of surgery. By then, not only should your skin incision be healing or healed, it should be very mature. So if you submerge it, there shouldn't be any issues. I do have some patients that at 4 weeks, it looks great. I let them get in. So talk to your surgeon and make sure when it's safe for you to submerge it if you want to get back into the pool or back into the jacuzzi or the hot tub. So I hope that really helps answer some of the questions that you may have as to what you should expect if you're heading it towards 1 month, or maybe you're thinking about knee replacement surgery and you're wondering what the first month may be like. This sort of gives you the expectations, the normal understandings, and really lets you know, are you on target, even if you have some of these symptoms, or should you call your surgeon if there's something more concerning than what I talked about here, or should you work harder with physical therapy if you're behind those 8 balls as far as range of motion on getting to full extension and getting to bending. So check in some of my other videos. You'll see about the terminal extension exercise and the straightening and bending exercise that can help you if you're missing those targets for your range of motion. Thanks again for listening. I'm Adam Rosen, and until next time, stay safe.